Good morning, my name is Rick Clare. I'm a equipment specialist and account manager at Cubro. I'm presenting today two of the chairs from our seating range. We've included the Fero range of seating in our large range to meet the demands and the high use in hospital wards. The Fero rest chair on my left, it has 5 different settings for height adjustment in the legs. So that gives you a seat height range of 450 to 570 millimeters. The back legs have 2 small casters to assist with moving the chair and between rooms or for cleaning. The synthetic armrests are built to take the high level of use. They don't have a vinyl covering which is easily worn. The shape of the backrest in the Fero range is designed to meet the shape of the patient, with higher density foam on the sides to support the lateral of the patient. The upholstery on the Fero chairs has a 10-year warranty. It's designed to withstand the high amount of cleaning and the use of alcohol and chlorine based wipes. Another feature on the Fero chairs is the seat base can be completely removed to assist with cleaning after a spill or general day-to-day maintenance of the chair. Our chairs have a 200 kg weight rating, so they're very strong, built to last and withstand the rigours of the hospital environment. The Fero tilt rest chair has a couple of extra features to the rest chair, one being the adjustment of the height in the armrests, so they can be completely lowered to assist with side transfer or a slightly wider patient, and then they can be locked in place at 3 different heights, which really assists with the patient lowering and raising themselves in and out of the chair. The other feature on the tilt rest chair is the recline of the backrest, so that can be unlocked and the patient can be into a recline position, and it can be locked in whichever position suitable. We are really excited about our range of Fero chairs. If you'd like to learn more or would like some more information on our range, please be free to give one of the friendly staff at Cubro a call.